Right. Take it away when you're ready.
As a team, it was our role to create an innovative approach to diagnosing joint infection, which we achieved through the use of a polymerase chain reaction known as PCR, accompanied by a clinical scoring system. In providing doctors with a more efficient and effective test, our innovative approach to the diagnostic method would combat the time-critical nature of decision-making that involves undertaking the necessary treatment methods, which could involve surgery and antibiotics. Not only will it improve the accuracy of diagnosis, it will also mitigate unnecessarily prescribed antibiotics, surgery, and admissions to the hospital. We believe that physicians, patients suspected of joint infection, and clinical researchers would best benefit from our diagnostic method. As seen on the left-hand side of our slide, we have created a enumerated process that enables physicians to assign patients a number from the clinical scoring system to determine the measure of the severity of infection and PCR.
PCR is a non-culture molecular method that has the ability to identify the resistance genes of pathogens. Several different DNA sequences can be amplified simultaneously using multiplex PCR. This design process allows for the early diagnosis of joint infection within several hours and hence prompts the early treatment of targeted antibiotics for the patient. The isolation of a pathogen by cultures of joint aspirates or periprosthetic tissue samples is considered the most critical method and to date gold standard for diagnosing PJI. An important element of systemic antimicrobial therapy is identifying specific bacteria, their resistance genes, and respective susceptibility. Thanks. This design aids doctors in predicting outcomes, making decisions, improving efficiency, and managing clinical risks. Scores are needed to inform clinical judgment. The clinical score of a patient indicates the severity of the joint infection they are experiencing. As they are based on the characteristics of the patient, this enables doctors to compare outcomes between different cohorts of patients.
A high clinical score may assist in the diagnosis of joint infection in patients with equivocal PCR findings, and a low clinical score may be referred to as a criterion to discharge patients. This design merged two other reliable means of assessing and diagnosing the presence of joint infection within patients. It was preferred on the basis of practicality and accuracy and promptly enabling the physician to devise the most appropriate treatment method. Through the combination of physical and microbial diagnosis, the clinical diagnosis of patients will improve as a combination of methods are used, instead of the isolation of physical or microbial diagnoses. Physical diagnosis alone can sometimes be misleading as a result of other factors, can have an impact on the severity of symptoms and pain associated with diagnosing joint infection. Therefore, through the combination of physical and microbial diagnosis, improvements in reliability of diagnosing joint infection will occur.
Thank you.
Thanks.